Hello, I'm Emma Hammett, the founder and CEO of First Aid for Life, onlinefirstaid.com and First Aid for Pets, and author of Burns, Falls and Emergency Calls and First Aid for Dogs. I'm going to talk to you today about burns and scalds and how to help if an adult, baby or child you are looking after or with or yourself suffers a burn or a scald. When I was working in the burns unit, I saw some really horrible burns. The sort that will be life-changing and will have horrendous long-term consequences. Long-term scarring, a lot of pain, probably skin grafts, and I would very much like to help you to prevent that happening. I'm going to explain, first of all, prevention of the accident itself, and then we'll go into the treatment for burns and scalds, what you should do and what you shouldn't do as well to give someone the best chance of a full and complete recovery. Babies and elderly people's skin is a lot thinner than an adult's skin generally. So it's more friable, more vulnerable, and they will burn with something that is generally that wouldn't burn the likes of me, although I'm getting on a bit. So what you need to do is just be very aware of things like hot cups of tea. A cup of tea that has been lying around or sitting there for 15 minutes can still be hot enough to burn a small baby's skin and do considerable damage. So even though it's hot enough, or it's a nice drinking temperature for you, it is still dangerous. So think about where you are putting the tea. Never have your cup of tea beside you while you're breastfeeding. And don't be tempted to pass cups of tea over people's heads. I've seen some horrible accidents when that's gone wrong. Make sure you are doing the common sense type things. Make sure flexes are back, so kettle flexes aren't grabbable. If you're using your curling tongs, make sure that you put them somewhere safe when they're cooling, because they will be very hot. And there's been a lot of very nasty burns when babies and children have crawled over to have a look and have ended up putting their hand on something that is still cooling down. Same with irons. Make sure that if you've got a heated towel rail in the bathroom, that you turn it off when your babies are of an age that they can pull themselves up, because they will pull themselves up because it looks like a ladder, and they may not necessarily twig that it is piping hot, and they may then not be able to let go, and when you take their little hands off because they're screaming, their skin will still be on the towel rail. So make sure that that towel rail is switched off while they're at that stage, because it's vulnerable and those towel rails get very hot. Get a thermostatic valve onto your bath if you possibly can, particularly on shower heads as well, so that when you're washing children's hair and things, if someone else flushes the loo and it changes the water pressure and nicks the cold water, and it's then hot enough to really burn them, that you're not making them vulnerable. So make sure that you've got some sort of thermostatic valve, or otherwise when you're showering them, shower it over your hand. At least you will realise very quickly if something has gone wrong. It's not ideal because that water will still be hot enough to burn them. When you're running the bath, always run cold first, and get one of those little bath thermometers. Don't rely on it completely. You also want to make sure that you're testing the water and everything, but make sure that you're putting cold in first and that you're testing the water before you put them in. And don't take shortcuts on that at all. So burns cause a lot of injuries to, particularly to little ones, also to the elderly. They're very often, particularly if they're diabetic, their nerve endings aren't as quick to react as they used to be, and so they may not realise how hot something is until it's done some serious damage. The same can happen as sort of, I remember one of my friend's children got out of a nice warm bath, and while they were waiting for their siblings to get out, they leant against the radiator So they were all warm and cosy and didn't realise that the radiator was actually burning their bottom until it had done damage, because they were already warm from the bath. So it's things like that. It's just being aware of potential dangers for burning. In with that as well, you've got things like button batteries. They can cause nasty internal burns. They keep the electrical charge will actually sort of cause acid, which then burns. And if a child stuck it in their ear or swallowed it and it's got stuck somewhere, it can actually erode through. I'm not going to cover those sort of burns today, but I will be covering other common burns, particularly to the surface of the skin. Okay, so your little one or someone else has got a hot cup of tea spilt on them. What should you do first? Should you take the clothes off or leave the clothes on? It's a question I'm often asked. It depends, is the honest answer. If they're wearing a big thick coat and the hot water or hot tea's over them, and you can be super fast and get the coat off very carefully but very quickly before the hot liquid has got down to their skin, then you can save them a lot of damage. However, if they're in a very thin t-shirt or something, and you can see that the skin has already started to blister, if you try and remove the clothes, the chances are you will remove the skin as well. Once the skin starts to blister, it becomes much weaker and thinner and more likely to come off. The moment you've got exposed areas of flesh underneath the skin, it's far more likely to get infected, and boy, does it hurt, because you've just got exposed nerve endings. So if any clothing or anything has stuck to a burn, you would never remove it. So what you will want to do is straight away put the affected area under cool running water. Have a look as well and see if there's anywhere else where this hot liquid might have spilt. There was one of my attendees on my courses had been in a coffee shop when a hot cup of coffee was spilt on a little baby's arm, and they rushed, they did all the right things, they put cool running water, so they popped them to the sink in the cafe, cool running water, they were doing that, but what they didn't do is check all over. That little baby had baby Ugg boots, or big thick warm boots on, and the hot coffee had actually gone down inside the boot and nobody realised, and had done some very serious damage to their foot. So cool running water on the affected area. Check if there is anywhere else where that hot liquid might have spilt, and treat very quickly and very carefully to make sure that you are cooling the burn. We are meat, so you are cooling the area to stop it cooking, because when there's hot liquid over, or when it's burnt, it is cooking. Cool running water really does work. I'd always been told that, and always been told that the 10 minutes was really important. And you know, when you're working in the burns unit, you sort of start seeing these horrendous things, and you sort of think, really, would that honestly have made a difference? The answer is yes. So cool running water will actually switch off the burning sensation and can reverse a lot of the damage that has been caused. I never really believed that until it happened to my husband. He'd burnt his hand because he'd reached in to get hold of an oven tray, and I'd very helpfully put the oven on, and he didn't realise. So he went to grab the oven tray, he burnt himself right across the middle of his hand, and he obviously let out an expletive. I came rushing over, apologising profusely, cool running water, put his hand straight under the cool running water, grabbed him a chair, sat him down, and I put the oven timer on for 15 minutes. Because cooling your hand, if you're not timing it, you're going to underestimate how much time you are using to, you are actually running that water, particularly if you're in pain, and particularly if it's a child or an elderly person who doesn't want to be kept under cool running water, but persist because it makes a difference. So he sat there, cool running water. The area had already blistered before I put it under cool running water. It blistered instantly. While he was sitting there, the blister went down. And by the time it got to 15 minutes, there was no sign of any damage and it didn't hurt anymore. I mean, he was lucky. It was obviously quite a minor burn. It did blister quickly, but we were able to reverse the damage. And that is what you're trying to do. In all burns, you're not going to be able to reverse the damage, but what you can do is minimise some of the damage that's occurred. So, for all burns, cool running water for at least 10 minutes. You think about taking out your joint of meat. You take it out, you put it on the side to rest. You rest it for about 10 minutes. It's still piping hot. You need to cool that burn for at least 10 minutes. Okay, so you cool it, cool it, cool it. You are cooling the burn, you're not cooling the person. If somebody is burnt, they are far more likely to suffer from shock. What happens with shock is your blood pressure drops. We'll cover shock separately on another Facebook Live. But just to explain briefly, your blood pressure drops. It's very serious and people die from shock. So shock is made worse if somebody is in pain, if someone is scared, and if someone is cold. You've got all those things happening when somebody is burnt. So what you want to be doing is cool the burn, but not cool the person. So keep them warm and dry, keep them calm and reassured as possible, and look for signs of shock. Signs of shock: pale, cold, clammy, feeling sick, feeling thirsty. If you see any of those, you need to get an ambulance as quickly as possible. Okay, so a burn bigger than a 50p piece for a small child is serious, because a burn is measured as 1% is the palm of your hand. So a 1% burn is serious. Excuse me. And a 1% burn on a baby is, again, extremely serious. So if you've got a baby or child who's got a burn bigger than a 50p piece, which is extremely red or blistered or the skin's come off, I would be suggesting that you get, you phone an ambulance and you get them on their way to come and help you. You are also cooling that area under cool running water. But if you've got a burn on a baby or child, or even on an elderly person, that is bad enough that you think you might need to dress it, I would be getting medical help and getting it seen properly as quickly as you possibly can. So cool running water, phone and get the ambulance on the way. Okay, so keep cooling it, cooling it, cooling it. If they really can't cope with that cool running water, the next best thing is one of these burns dressings. If you were using these, they're the same as, I don't know if you remember in the 7/7 bombings, there was a picture of a lady with a mask on her face. That was a burn dressing mask. It's something that the paramedics and the firefighters use where there isn't direct access to clean running water, and it's the next best thing. Cool running water is best for burns. This is next best thing, and you would ideally use it when you have cooled the area. If you've got somewhere that you just can't work out how to cool under cool running water, then your next best thing is to put that on without the cool running water. But the best is cool running water. Either get the emergency services to come and look, or once you've cooled it for 15 minutes, you can put your burn gel dressing on. It comes out covered in this gloopy stuff. It's like the sort of packaging that you get a TV in, or it's like packaging, and the gel is on that. So what you will need to do is put the dressing, wash your hands, and use sterile gloves if you possibly can when you're dealing with burns. And then you would put the dressing on the burn, you pour some of this gloopy gel on top as well, and you have a dressing ready to wrap gently around it to support the area. and then you would take them to hospital to get that burn seen to. All burns should be assessed by a medical or health professional, because burns get infected very, very easily, and they should be dressed in a proper sterile environment by a health professional and assessed properly. Okay, so that's your next best thing. The other thing you will have heard of when talking about burns is dressing them with cling film. So, yes, cling film is good stuff. In a hospital environment, and the paramedics will use proper medical cling film. But your home cling film is absolutely fine, it does the job. What it does is it covers the burn, which then covers the nerve endings, makes it less painful. It makes it less prone to getting infection, and it means that the health professionals can actually see the burn when you get to hospital, and they can assess it without having to poke and prod around with it. Please do not be tempted to go straight for the dressing. If you haven't cooled the burn, then you are still cooking. If you are still cooking and you wrap it in hot plastic, you will poach, and you do not want to poach a burn. So cool for 15 minutes, even 20 minutes. You're cooling so that it isn't hurting as much anymore, and you're cooling and you're timing it so that you're switching off that burning process. You would then discard the first couple of layers of there. You're wearing sterile gloves. You discard the first couple of layers, and then you would put it loosely over the burn. I'm showing this with a watch. You will have taken off watches or jewellery if somebody is burnt, because the area will swell and that will become tight. So you would put this over the burn and you'd wrap it very loosely because the burn will swell. And then you are taking them to hospital to get it looked at. And as I said before, I wouldn't rush to dress a burn on a baby or child. I would much sooner that someone came and assessed the burn whilst you were running it under cool running water, so that you're not rushing and putting them in the car and going down to the hospital before you have cooled it properly. Okay, so that is how to treat a burn. I do hope that was useful. Our Facebook Live next week, I'm very happy for you to suggest topics. I was thinking we might do fitting and febrile convulsions. We could do something on CPR, we could do recovery position, we could do poisoning, we can do asthma, we can do anaphylaxis, that might be a good one. Do anaphylactic shock and how to recognise an acute allergic reaction. So next week, 10 o'clock on Tuesday, please tune in, and I look forward to seeing you then. So that's Emma Hammett. I run First Aid for Life. That's www.firstaidforlife.org.uk. My email is emma@firstaidforlife.org.uk. I also have onlinefirstaid.com, where we have a whole load of online courses, and we've got free resources on our websites too. And we also do First Aid for Pets, and I will start doing some Facebook Lives for First Aid for Pets very soon as well. Thank you very much, and have a good day.